All right, we're live. Thanks for watching, Doc. Today, I'm going to talk to you about the two types of offers that you can use to get qualified patients for your practice. And more specifically, we're going to talk about how to use something like this to get you more spinal decompression patients and knee decompression patients specifically. The offer structure works amazing. I want to maybe address the elephant in the room before we get too far into this. And it has to do with the question that after 8 years of doing this, that I have gotten maybe more than any other question. It's a scenario that comes up, and I just want to make sure that we're all on the same page. Mostly because instead of you getting 10 to 20 client from your business right now, if you want to double or triple that, you're going to need to understand this so you can scale your practice to a seven-figure practice, which is what most people want to do. Doesn't mean you do, but let's talk about offers. Now, this is an interesting metaphor for an offer, but the question is, should you be making offers in the first place? And if so, why? Why isn't it, why is it my opinion that you should? And why do some people think that it discounts and cheapens your services? Well, first and foremost, there's nobody saying that you have to use offers in your practice to get patients of any type. All we're saying is you want to get them in bunches and at scale. Advertising is the number one way to do that. Now, you can get referrals, you can get organic. So if you're doing a lot of reviews and you're doing a lot of SEO, you can get organic patients as well. But if you want to scale your practice, if you want to add not just 2 or 3 additional patients in a week or a month, if you want to add 10, 15, 20, 30, 40 or more patients for a month, you're going to have to understand and use the art of advertising. Now, there's 2 types of offers that you probably have not distinguished in your mind, but you'll understand here in just a minute. There's your core offering, which this is not. Your core offering is what you sell to get an out. So if you're doing spinal decompression cases, that would be the entire care plan that you offer. So just depending on the person's condition, we'll give you an example. 10 treatments plus chiropractic care plus physical therapy in a care plan for a total value of $3,500. That is the core offering of what you would do in your services when you offer for spinal decompression. The trial offer is where this little dandy comes into play. Now, what is this and what is a trial offer? Let me start out with what this is. This is something called a monkey fist. And basically, as you can see, it's a small with a cord attached. And what you can do is you can take this small ball and you can attach a rope to it. And that rope then attaches to a large chain. That chain is then attached to a large cruise ship. So if you were to dock a cruise ship, you would take this and you were on the boat. You would take this and you would throw it from one hand to the next to the person who's down on the pier. And they would then pull in the rope that would pull on the chain. What does any of that have to do with your practice and with trial offers? Well, this is the little thing that solves a little problem, but then solves a big problem. Or in other words, this is the trial offer that leads more people to your core offer and to your core services. And without this, you might be able through organic methods to get, 2 or 3 extra patients a month. But with this, you can get 20 to 30 extra patients per month. Why? Well, because if this is your trial offer and you put a complete small solution out to your audience. So for example, in the realm of spinal depression, if you put, relief for those suffering from sciatica pain, it includes 2 sessions of spinal decompression therapy. It includes, consultation, report of findings. That way that person knows what they're going to need to do to not just alleviate their current pain, but solve this problem once and for all. If that's what you offer, we have proven that to not just 10x, but in some cases 20, 30x practices using that strategy. Okay. Now, what people complain about is 1, They complain about not being able to convert those leads into patients. And I understand that. But if you understand the psychological frame that people enter into when they're taking you up on this small thing, and you don't carry that through to your big thing, which is your core offering, as long as you have the right frame, or as long as your words are framing what the two things are, you will be able to scale like crazy. And here's what I mean. Hey, Mr. Smith, thank you for taking us up on our offer. It includes two sessions, which is a great way for you to see that our services and that this protocol will help you. If you want to get the overall result, I'm going to walk you through how that works. Now, before we can do that, we need to see to what extent is your sciatica pain, is your disc pain, is whatever. And we can't do that without proper exam, consultation, and what we call a report of findings. That report of findings will tell us where on the spectrum, how far damaged is your back pain compared to the other people that we've seen. Because of course, somebody comes in with minor back pain, we need to fix that quick. Some people come in, next step is surgery. That may take a little longer. So we need to identify where you're at. Boom, we're done. We've talked about the trial offer. We've talked about why there's a core offer and how they delineate between the two offers in their mind. And as you take them through your day one, day two, you'll be able to show them the value of your core offer. So if you want to learn more about how to grow your practice and how to use trial offer with a successful monetization strategy, we have a demo we'll show you. Go to mypatientstream.com, mypatientstream.com, and you can sign up for a demo. Thanks for watching.